Do you know that of the 38, forgive me, of the wealthiest countries in the world, we rank 38th in terms of our healthcare? We got lousy healthcare, right? Considering all the money we have, considering that we are still the United States of America, we got really lousy healthcare. Thank you very much, Obama and Obamacare and insurance companies, right? And the big hospitals that are all getting rolled up and they say they're nonprofit, but I'm sorry. Look, there's a lot of things wrong with this, a lot of things wrong with this. So I sat down just yesterday. I'm still here. We can talk about the interview as we're watching it in real time. I sat down with Lauren Stewart, who is like, wow, like super smart on healthcare. And she is leading an effort to totally redo not totally redo, because you could keep what you have. You want your Obamacare plan, go for it, right? But she would like to see, and this is why it's so important that we see conservative values represented in Washington, in the Oval Office, in the Senate, and in Congress. We want that because we want new things, new ideas that look out for the individual instead of the big insurance companies, instead of the big hospitals. That's what we need, America. You know how crazy health insurance costs are. They keep going up, and away, kind of like college tuition, right? Funny. And you see what happens on colleges. The kids are like clearly not valuing their education. And what happens with Americans' healthcare? Well, it's continued to deteriorate. Lauren Stewart, I'm just so happy that she was able to join us because this is a meaningful conversation. Let's watch. Lauren, great to have you. Thank you so much for being here. Look, this is such an important issue right now. I was looking at some statistics. We talk about inflation all the time, but it's incredible because from 2014, we're looking at the average deductible in healthcare being up, some 60%. I mean, this is really just outrageous. Like, this is inflation on steroids. And I look at this and I go, like, why? Like, what is going on?
Yeah, absolutely. Well, the president talks a lot about healthcare, and what he's attempting to do is to rewrite his record on healthcare for two reasons. Number one, a lot of his failed policies are at the core of many of the problems in our American healthcare system. And number two, there's an election coming up, and healthcare is a top issue for key voter demographics, especially suburban women. So the president will talk about how many millions of Americans have insurance under the Affordable Care Act. But the problem at the core here is that health insurance does not mean that you have real access to quality health care. So here's the real perspective of healthcare in America. 80% of Americans say that they feel trapped in their healthcare and they want more options. All the while, President Biden is doing things like slashing Medicare Advantage programs that many seniors loved and opted into, and working to permanently eliminate short-term health insurance plans that many young people find to best fit their lifestyle. The president's record on healthcare is the problem in healthcare, and it's nothing he should be boasting about.
No, I don't think he's got a lot to boast about, honestly, right
now.
Yeah. It's just, and you don't have to take my word for that. I mean, just look at the latest polls, for goodness sakes, or the approval ratings. But, people have talked about how do we find a solution for this? Because the reality is it is way outpaced. I mean, inflation is high, right, for everything, but healthcare inflation specifically has been so much worse, perhaps because of all this government control. I know that you're coming up with what you call the personal option. By the way, people can check it out at personaloption.com. Go to personaloption.com. AFP is all over this. Lauren's all over this, but there's ideas there to make this something different. I think a lot of people have tried it, right? I think back to the Mitt Romney days, and that didn't really work. You look at Obamacare, people are really unhappy with Obamacare. Biden's coming up with something else, but there is a conservative version that would put more power, if you would, in the hands of the individuals so that they can make their own decisions about healthcare, and in doing so help drive costs down.
Yeah, absolutely. So as with anything in healthcare, there is a golden rule. He who has the gold makes the rules. In the American healthcare system right now, the insurance companies have the gold. They control the vast majority of dollars spent on healthcare in our country. They can decide when, where, how, and when you cannot spend those dollars on healthcare. Now, healthcare expenses for any family are the most personal dollars you're going to spend. It's your well being of you and your family. And if we wanted to drive better health outcomes in that space, we would allow patients and families to control more of the money they're spending on their healthcare. We need to be more focused from a policy standpoint, from a solution standpoint, on funding and empowering patients, not the system.
Yeah, I think people agree with you. I mean, I just look at the comments that I get from viewers all the time, and they're like, "Oh my gosh, you wouldn't believe how much I'm paying now for my
It's
insurance."
awful.
And so the insurance bills are high, and then that's if you can get what you need out of your insurance, because even then, there are more sort of additional problems. There's a couple of pieces of legislation. I think Pete Sessions has one. You've got Greg
Yes.
Steube has one. And, people are talking about this. Cat Chemic has one. I mean, we've got to have, I think, innovation in this space. You look at all the innovation out there. Lauren, I mean,
Yes.
it's incredible, right? With
It's
technology and
amazing.
everything, like it's just incredible what we're capable of now. So it's sort of like, how can we not fix this? How can this is something so basic?
Yeah. Yeah, absolutely. I mean, and the landscape is really different with this. The president, Democrats have been running on healthcare for years unchecked, but it's these policy solutions, the one that you mentioned from Congressman Pete Sessions, the Access Act from Congressman Steube and Congresswoman Kamek are a big deal. For instance, the Healthcare Fairness for All Act creates much needed parity in the healthcare system. This bill would allow all Americans to have access to an incredible health benefit called a health savings account. Similar to a 401k, the health savings account allows you to put away pre tax dollars to use for qualified medical expenses. Under this legislation, families would be able to put away $4,000 per adult and $2,000 per child each year. That's $12,000 of
And they
tax
can use it
advantage
at any time
dollars.
in the future.
Yes, they can save it. They can use it for their future health needs. They can use it for prescriptions, over the counter medicines like allergy medicines, which I'm in Washington, D.C. right now. So I'm spending a lot of money
Oh,
on that.
those cherry cheese trees will get you. Yeah.
Yeah, and additionally, and this is kind of one of the best benefits of a health savings account, is it allows to see the doctors that you want, regardless of your network, whether it's an amazing network or a shrinking insurance network like the ACA. You can use a health savings account to pay to go see whatever doctor you would like.
What would this mean for the insurance companies? Are they fighting this?
So there's a number of components, right? There's been a lack of competition in healthcare that has driven up the cost for American patients and families. Why is that? Well, that's number one, because it's made generic drugs a lot more difficult to come to market. That drives up the cost of medicine. It's also fueled massive hospital consolidation by encouraging hospital monopolies. So at the end of the day, we would be shifting the dollars in healthcare away from the control of insurance companies and back to patients and their families. I do
Isn't
still
that
think
what
it's
we want, right? Like that is so what we want. And I bet you
absolutely.
talk to any doctor, and that's what the doctors want too.
Absolutely. Doctors, are increasingly more frustrated with the amount of time they're able to spend with their patients. There are really neat innovations out there, such as direct primary care, concierge care services that doctors absolutely love. But the incentives are off in the healthcare market, and doctors, providers, and especially patients are trapped in the crossfire.
Gosh. So what can people do? I mean, the first thing I would advise them to do is go check out all the information you guys have on personaloption.com. I say all the
Yes,
time that we have to be our own advocate. We have to push our lawmakers. We
absolutely.
have to, you have to vote, and you have to vote for the right policies. Don't tell me people are, oh, policy, it's boring. Look, this is the stuff that
Yes.
changes our world. And so, I mean, kind of love it for that reason, but
Yeah.
it's you gotta kind of sink your teeth in, and I think demand of all of our representatives to get behind something that's different, because
Yeah.
it's not sustainable this way.
Yeah, absolutely. I would say the biggest thing that people can do is number one, know that it doesn't have to be this way. We have the personal option, which is our legislative agenda, which is our outlook on healthcare in America, that all Americans should have a personal option in their healthcare. Know that that's something that's out there. And the only reason that we aren't there right now is because the government and failed policies under President Biden have put in roadblocks and barriers to that. Additionally, I think we should be tuning up to the fact that the landscape of who can win the healthcare issue in 2024 is extremely different this year. When we talk about policy solutions, real policy solutions in healthcare that are Republican led, such as the Access Act, such as the Healthcare Fairness for All Act, that significantly challenges the status quo in healthcare that most of America is unsatisfied with right now. So it's something we should all be talking a lot more about, and something Americans can quite frankly get excited for.
Yeah, no, for sure. So let me ask you this. I mean, look, not everybody's going to have the means. Not everybody is going to have the HSA. I know that I think you said only 10%. I was looking at some of your research of Americans
Yeah,
actually have this HSA access right now. So hopefully that all changes. But suppose you're on the very bottom tier, and
yeah,
life is very much day to day and very, very challenging, and
of
maybe you
course.
don't have the kind of ability to even access some of these better options. What happens to those people?
Absolutely. And we're feeling that more than ever right now, right? Under massive inflation that we've never seen before. Those people that I think of immediately come to mind when I talk about the Access Act by Congressman Stubbe and Congresswoman Kamik. This bill affects the lowest level of income of people on Obamacare. It would allow them to take a portion of their subsidies. So we're already subsidizing their health care. It would allow them to take a portion of that subsidy in the form of an HSA, in the form of a health savings account.
Okay.
What this does is it combats the problem that we have providers leaving the marketplace more and more every year. So it would give them much more access and choice in their healthcare, but it would also empower them to make decisions about what their need for their healthcare, what their family needs versus just what's in their shrinking network. Now, that's all well and good. We're funding patients through HSAs and Obamacare, but even more importantly for what's upcoming with the fiscal cliff, and as a fiscal conservative myself, this bill saves taxpayers $30 billion over the first 10 years. And you might say, why? How is that? We're still subsidizing these lower income folks' healthcare, but it's because we're directing those funds directly to the patient and removing the insurance as the middleman, thus managing the subsidy even more efficiently. And we at AFP love this legislation because it expands healthcare options for lower income people. But we've also done national polling on it as well and found 82% of Americans support the Access
Yeah,
Act.
look, I mean, people want to be in control of their future and their destiny, and yeah, their health
Absolutely.
care, no matter their income level. Like that is,
Y-
it's kind of basic. So
Yes.
listen, we should stay on this. I should talk to you some more. I think this is a really,
Yes.
really, really important issue, and one that we have some opportunity on as fiscal
Absolutely.
conservatives, right? To kind of do the right thing going forward. Thank you so much for your time, Lauren. Great to have you here again. Lauren Stewart, Senior Federal Affairs Liaison at Americans for Prosperity. Go to personaloption.com. Check out her work there, and we'll see you soon.
Thank you very
Okay, my thanks to Lauren. I was talking to some of you guys in the chat, and it was really interesting because we were obviously in agreement that healthcare is obviously completely broken. And a lot of that is the onus on the individual, too, because people are not taking good enough care of themselves. And suddenly it's in vogue, right? To not take care of yourselves. I mean, when the Victoria's Secret catalog arrives and you get the plus size models, I mean, I'm sorry, it's just not healthy. I know somebody's going to take issue with that, but it's not healthy.